Hi, I'm Dr. Sue Decotiis. I'm here in New York City, and I'd like to talk to you today about peptides. So peptides are simple chains of amino acids that are made in a lab, and although they're very simple structures, the laboratory can make them so that certain amino acids that are sequenced can cause very incredible effects on the body, and they're very safe and easy for the body to break down. The one I'd like to tell you about today is something called alpha-1 thymosin. So this peptide is FDA approved, and it's known to be a very potent immune modulator. So in my practice, I like to use it with patients who have issues with ongoing viral infections, frequent colds and flus, hepatitis. We can also use it for cancer patients to help them respond better to their treatments during and after chemotherapy. And the other area where it's really important, patients are getting a lot of benefit from using alpha-1 thymosin for Lyme disease. And as we're now beginning to realize that Lyme disease is a disease that can stay with you for a long time. And the bacteria that causes Lyme disease can cause a real alteration in the way your immune system functions, even if it's been treated properly with antibiotics. And one of the things that happens with Lyme disease, and often, as we know, especially here in the Northeast, in the New York City area, New England area, many people get bitten by ticks over and over again and get re-exposed to the same infection. And what can happen over time, or sometimes even initially after the first infection, is that the infection itself oversensitizes mast cells. So mast cells are parts of the white blood cell system in the body, and they release histamine. And that's an important thing to do in the body's defense. So for example, if you get a bee sting or something like that, histamine would be released by the body to reduce the effect of that bee sting. However, if it's released in excess, the patient can have many inflammatory problems throughout the body. And that's why so many people with Lyme disease have issues with ongoing fatigue, unexpected allergies, wheezing, tremendous aches and pains, mental fog, decreased cognition and memory. So we found alpha-1 thymosin to be very helpful for patients with Lyme disease. And it's been very helpful in my practice with patients that have these problems. Alpha-1 thymosin can also be used for immune modulation in people with autoimmune diseases to help the immune system stop working against itself, which some patients with a genetic tendency tend to do. So I found alpha-1 thymosin to be very useful. It doesn't need to be used usually for more than 6 months. It's safe, and it really has lasting effects on helping boost the immune system.